Dear friends, I am happy to talk to you on the fan. I am happy to talk to you once again this Saturday, 8th February 2024. We have finished 1523rd case of Puberphonia. Really, what we have done the last 7 days, I want to tell you because every day I am planning how to go for a corporate setup for this Puberphonia treatment by us. We have written so far 42 books. Among them, 7 are Puberphonia books. There are 3 Tamil books, remaining are English. Only 3 big books. All the other 5 are notes only, which we give freely for the public. Now we are just moving to colleges. So what more we can do? So we have given sufficient so-called uh, interview in different newspapers, and we are able to get lot of patients throughout the India. There, one of my friend from Delhi, Mr. Anil Sharma, he is running an international magazine for tourism purpose. Anil Sharma is the editor of this big magazine by name India. Just like medical tourism, Incredible India. This he is publishing. Mr. Anil Sharma, he is from Delhi. He is the editor of this magazine. He described whole thing about Kumbh Mela, Maha Kumbh Mela. This is a special issue. This issue, the editor Anil Sharma had interviewed me, and he had given a good account of Puberphonia. What I am doing in Puberphonia, what is the treatment we are giving in Puberphonia. He had given a very big advertisement for me. So this is actually, he has mentioned a revolution in medical treatment, breaking ground in Puberphonia treatment, a revolutionary approach by Dr.Kumaresan. He has clearly written what is the service we are giving for Puberphonia. Along with my son, Dr. K. Navin Bharat, he is also a leading ENT surgeon in Chennai, and he is a additional professor of ENT in Savida Medical College. And we have successfully treated more than 1,500 cases of Puberphonia at that time. Now it is increased to 1,523 cases. So what is the science behind the success? So we are not treating Puberphonia by any surgery. We are treating in a holistic way, without surgery, without medicine. Even though I am a ENT surgeon, we are very much interested in treating snoring by doing surgery in and around uvula. Uvula is a small fleshy mass hanging in the back of the throat that usually called as little tongue. It only directs the food when we swallow. It prevents the food from entering into the nose. Regurgitation is prevented partially by uvula and mostly by soft palate movement. So the same technique we are using. So we achieve a new success in the treatment of puberphonia. So we are making awareness of puberphonia, spreading awareness through social media. If anyone see the YouTube Puberphonia Dr.Kumaresan, immediately you will be able to see our videos and what is the work we are doing for puberphonia. Similarly, Instagram, Facebook, if you see Dr. M. Kumaresan, you will see what are the information we will give to that, and our special website also there. Okay, so that will give a more enlightened view. What more we can do? Our website is www.sivaent.com, and our email is kumaresan@doctor.com. Our phone number is 98410557774. We are having our own hospital that is in Shanmugam Sale, Royapettah, Lloyds Road, Chennai 14. So we know that we got 2024 an award nationally that our book is recognized well. So we have to thank the editor of this great magazine, India. Even in the editorial board, he was Mr. Anil Sharma, editor, has given a lot of information about Siva ENT Hospital and our work. I have to thank the special correspondent Sudha, executive editor Gautam, and correspondents Dankak, photographer Amit Sharma, graphic designer Naha Singh, web team Avinesh, marketing Varma, circulation executive Gupta, director marketing Bhargaraj. So their office is not only in Delhi, they are having their own office in London at Middlesex. So they are able to spread the awareness of puberphonia globally. So what is my work last week? You will be happy to know we have conducted a camp at various colleges. We are conducting camps. Now, February 4th, we had the chance to conduct a meeting at St. Peter's Institute of Higher Education and University, Avadi. This is solely arranged by the Department of Biomedical Engineering. So we are happy and we participated in that World Cancer Day. So it is actually a cancer awareness program. We are able to give our view, and this is solely organized by the Department of Biomedical Engineering on the World Cancer Day. And I was so happy. The Vice Chancellor, the Registrar, and the Deans were of the St. Peter's Institute, University, responsible for the program, made it very successful. And I have to thank Professor Dr. Venkatraman of St. Peter's University. He is the dean who had come and introduced me. Not only like that, he had headed for that seminar, and I was able to give a talk on wholesomeness, from wholesomeness to hope. This is the word coined. So, what are the changes of voice you can get in person by everyday trauma, voice abuse, voice misuse, and the resultant future is having a cancer. We know that very well. In the human body, the common place of cancer, that is the maximum number of cancer that you can note only in the oral cavity. That everybody knows it. This is because of using lot of tobacco by smoking or pan barak or alcoholic drinking. So this causes the mutation of the cell. So oral cancer is the commonest thing. The third cancer, which is very common, is laryngeal cancer, larynx, vocal cord. Luckily, there is a pre-malignant condition. If we are able to diagnose the patient in the pre-malignant condition, we can cure that disease 100%. So what a good thing we are having. So we have to thank Dr. Venkatraman of St. Peter's University. And we had Dr. Chandrasekhar from London. He was kind enough and give a small talk on also. He's a scientist from London. He participated and he has done more than 100 original work on mercury. All the things are arranged by the department concerned people, Professor Faisal, Satish Kumar, Hemavati, and other people. But man behind the show is Professor Dr. Kandaraj. Kandaraj is well known to Tamil Nadu, very popular. Professor Dr. Kandaraj, MD, venereologist. Basically, he is my colleague. We studied together in Madurai Medical College. We studied together, even though he is 1 year senior to me. We had attended 5.5 years. We studied together in Madurai Medical College. Then lot of changes are there. So we continue our relationship as a classmate for so many years. He has arranged the meeting for me to tell about the voice changes on the Cancer Day this month of 4th February 2025, where I was able to attract more students and make awareness of the voice. The head of the department of bioengineering department of St. Peter's Institute, Siva madam, very interested doing research work, and she is willing to take up a project on voice change. Here, on reaching St. Peter's University only, we had a discussion with a London professor, Dr. Chandrasekhar. He has seen, he is basically born in India, but he is a native of London, British citizen. He is a pensioner from British government because he worked in, was professor and researcher at Imperial College, London, very well recognized university. He had given a new idea to me to the students of bioengineering department of St. Peter's Institute. We have to help the transgender. His idea is we should help the people living with us in the name of transgender Tirunagahar. We should help them. Basically, all over the world, everybody knows we have treated 1,523 cases of Puberphonia. That means boys talking in female tone we are treating. Okay. We are making high pitch voice into low pitch voice. Dr. Professor Chandrasekhar from London, he told us he want to help us in the Imperial College of London level. Can we take a challenge of correction of the voice of transgender? Because all the transgender are worried about their voice. They will be recognized by their voice. So they want to have some good treatment for the voice change. Definitely, there is a possibility of change of voice in transgender because their voice will be high pitch. Transgender voice care can help people achieve a voice that matches their gender identity. Yes, therapy is available, but not to all the people. Their gender identification should match with their voice. That is what they want. I hope you will be able to understand. This is what Dr. Professor Chandrasekhar like. Transgender people appearance is different, but their voice is different. Voice is culprit. So can you able to change the voice? This throughout the world. This is done through voice therapy, hormone therapy, or surgery. But 100% successful is not achieved. See, we are treating high pitch of puberphonia into low pitch. In transgender voice, this is so high pitch. So can you able to change it? Yes. Voice therapy help people to learn to manage their throat, face and mouth muscle to change the resonance of their voice. You have to help them to manage their throat, face and mouth muscles. The resonance should be changed. Voice therapy can help to change the pitch. Voice therapy can help to change the resonance. So similarly, their non-verbal communication also should be changed. Voice therapy can help people learn communication style that matches their gender identity. Nowadays, hormone therapy is famous in changing the voice for transgender. Hormone therapy can help transgender men to achieve deeper voice. But however, this hormone therapy is not so effective for transgender women. Surgery can achieve it, definitely. But it is a very minute operation. So 100% success you cannot guarantee. It's shorten, and by thinning the vocal cords, you can get the voice. We can achieve in lowering the voice by loosening the vocal cords. So we can achieve a feminine voice by surgery in the glottic, in the larynx. Most of the transgender, when they communicate, they usually communicate not with their voice. They use hand gesture, facial expression, body posture, and eye contact. So a proper voice evolution should be there, and we can help these people. So I have to try with transgender people whether the same technique of euler resonance manipulation and training will help the people. Yes, I have to answer. Does transgender voice change? How to tell if someone is transgender? What is the voice of a transgender woman? How to fix a transgender voice? How to tell if someone is transgender? How to tell? By seeing or hearing. Yes, hearing is the very, very, very important. Social communication. That is the important one. So, if you want to tell someone is transgender, you hear what is the pitch they talk. You cannot rely on physical appearance only. So the gender identity different from the sex they were assigned at birth. So from the voice itself, we have to assess it. Not only like that, what is the needed voice, needed pitch, needed quality, needed resonance a doctor should provide for a transgender. This is a great help. What is the type of voice? They are not happy with the voice they have. So the voice should be changed or trained. Trans women usually seek out a higher pitched, breathier voice. They tend to pursue voice training more often than trans men do. Two category: trans female, trans men. So what is the change they want? What more a ENT surgeon help them? So that we have to do it without much problem. We should give a 100% guarantee. I just want to do it. But the important consideration is privacy is crucial. Never assume someone is transgender based on appearance alone. Always respect their privacy if they have not disclosed their status. Very, very important. Privacy is crucial in medical field. Repeated. Never assume someone is transgender based on the appearance alone, and always respect their privacy if they have not closed their status. So respect them. And educate. Very, very important. Education, education, education. So that is very important because their privacy should be maintained. Very great thing we should be able to follow because it is their life. We have to help them to have a good life, help them to live with the common people. If their voice is changed as they like, then they can live with the community. Also, they are living with the community, there is no question at all. But still, as ENT surgeon, we have to do something to consider the voice and treat the voice without any operative procedure or big medical procedure. Here I want to emphasize this Saturday, 8th February 2025, we have treated 1,522 cases of Puberphonia, 23 cases of Puberphonia. So this had given a new inspiration for us. Why not we help the transgender also. So a new research we want to do in collaboration with some of the university level and make it a grand success. So I will meet you once again next Saturday. Thanking you. Great, happy this Saturday.